So, for my final project, I focused on the intervention of the social use of language in children with autism spectrum disorder. So, children with autism spectrum disorder exhibit a deficit in social communication and spoken language, among other deficits. Naturalistic interventions have shown to be effective for prompting social communication skills in the natural environment. So, my first article was Social Pragmatic and Naturalistic Behavioral Interventions on Language Use and Social Engagement in Children with Autism. So, the purpose of this article was developmental, social pragmatic, and naturalistic behavioral interventions share a number of features, but they differ in their use of facilitative strategies and direct elicitation of child language. In this study, the authors investigated whether these approaches produce different language and social outcomes in young children with autism. The authors use an A-B-A-C-A-D design to compare three types of intervention on language type and function and social engagement in 5 children with ASD. So there was three types of intervention. The first one is social pragmatic, which focused on increasing the adult's responsiveness to the child and establishing turns between the child and adult. The second one is naturalistic behavioral, which uses direct prompting and reinforcement within natural context to teach specific social communication skills. And the third was a combined intervention between the two. So, some results and major findings of this article were that all 5 children had higher rates of total language targets in at least one of the intervention options. 2 out of the 5 children showed improvement in all three intervention strategies, and responsive interaction had lower rates of total language targets than the Milo teaching and combined intervention in all children. So for prompt requests, all children use more prompt requests in the Milo teaching and combined intervention than at baseline. Spontaneous requests, all children had improvement during treatment than at baseline, but the differences were small and less pronounced between conditions than rates of prompt request. For prompt comments, all children showed improvements in at least one condition compared to the baseline, and the overall rates of prompt comments were low. And then lastly, for spontaneous comments, all children except one had low rates across interventions. So the conclusion for this article is that for children with autism, naturalistic interventions that use direct elicitation of child language led to greater short-term gains in the use of expressive language targets than interventions that use facilitative strategies only. All three naturalistic language interventions can promote social engagement. For some children, the combined use of direct elicitation and responsiveness based strategies may enhance treatment response. For my second article, I used generalized effects of naturalistic social communication intervention for minimally verbal children with autism. So, the purpose of this study was to examine the generalized effects of joint attention structured play engagement and regulation and enhanced Milo teachings. Intervention on social language in children with ASD who are in the early stages of language acquisition. For the method, the author used a multiple baseline design to develop, evaluate, and refine intervention procedures. It was to demonstrate um, those two interventions and a combined intervention among 3 participants with ASD. These are the type of interventions. So, Jasper was the first one. It's shown to increase expressive language as well as joint attention skills and play. Scaffolding joint attention, modeling play, and joint attention, responding to child play, and communication, expanding, and arranging the environment. EMT uses environmental arrangement, responsive interaction expansions, and promoting techniques to facilitate social communication in a naturalistic manner. Also, following the child's lead and modeling language targets and social communication. And then for combined intervention, combining the two. For results, the first participant showed clear change in total targets and more moderate and unprompted target use after intervention was introduced. The second and third child participants demonstrated slower but more consistent changes in total and unprompted targets over the intervention phase. For participant one, he showed an increase in all of the in all of the areas, except for one, he did not show progress or decline in symbolic play from baseline to post assessment. Participant 2 and 3 showed an increase in all areas. The areas it consisted of NDW, spontaneous comments, MLU, pre-symbolic and symbolic play acts, initiated behavior regulation with words, and initiated joint attention with words. So my conclusion for this was that overall, this study indicates modest initial context-bound effectiveness of the blended Jasper and EMT intervention for 3 children with autism. The data indicated that generalization of target social language remains difficult for children with entry-level skills even after 15 to 20 sessions of intervention and systematic teaching to generalize or additional intervention by other communication partners may be necessary. And then these are my references.